At the Center for Biomechanics and Rehabilitation Technologies at Staffordshire University, we conduct a truly multidisciplinary research which is original in many aspects. The interdisciplinary methodologies that we use to answer the research questions involve aspects of science, engineering and technology, including computer vision. Our research outputs and the range of international collaborations we have show our research has a wide-ranging global impact. Over the years, we have contributed to extending knowledge in various scientific and clinical areas. We have made substantial contribution to the development of foot and footwear biomechanics, ranging from influence of footwear not only in the treatment of foot problems but also on how they affect the growing foot. The development of foot problems in children and teenagers because of their footwear choice is an area of interest, in addition to contributing to the evidence base and clinical protocols for orthotic and footwear use within frontline clinical practice. Our work has had a worldwide impact on understanding foot complications resulting from diabetes. We have delivered projects relating to the prognosis, prevention, diagnosis and treatment of diabetic foot. This work has had a huge change in clinical practice. Methodologies and techniques we have developed over the years are being used in clinical practice and making a difference in understanding human form and function. Our scoliosis work is highly cited and we contribute to understanding the etiology of adolescent idiopathic scoliosis. We have established collaborative links with partners across Europe, and currently we have a huge program of work, some of which is funded by the British Scoliosis Research Foundation and supported by the British Scoliosis Society. In terms of rehabilitation medicine, as the global society is getting older, we have developed simple screening tools to assess falls and frailty, and the interventions in terms of exercises designed for older individuals.
While our centre conducts a lot of laboratory-based experimental research, we have also established expertise in research connected to policy development. The COVID-19 pandemic has had a huge impact on the NHS. In September 2020, we researched its impact on orthotic service provision, which found the introduction of telehealth for the first time in many services to ensure patients could continue to access care. While widespread use of telehealth developed in response to the pandemic, it is here to stay, as it is part of the NHS digital transformation plan. The pandemic just accelerated its introduction. This initial research led us to conducting research funded by the Office for Health Improvement and Disparities to review telehealth use within allied health professional services in the NHS. This research identified that existing guidelines for telehealth consultations do not adequately support allied health professionals. Specifically, they lacked information on safety considerations, training requirements, and patient suitability criteria. In response to this, we are developing a framework to guide allied health professional telehealth patient consultation guidelines. We have engaged with national and international stakeholders, including the professional bodies of the UK allied health professions, to ensure the framework meets the needs of the allied health professional services with the aim of improving patient care.
The research I'm leading is by nature interdisciplinary. I'm a mathematician and an engineer involved in clinical and healthcare technology research. And that's because I want to help people. Integrating knowledge and methods from numerical modeling, mechanics of materials, computer vision and medical physics into healthcare research has enabled us to produce unique, out-of-the-box solutions to major clinical challenges. These include the development of cost-effective, easy-to-use screening tools for falls in older people, novel wearable sensors to detect injurious loading in at-risk tissues, and the optimization of interventions for people living with long-term conditions, such as diabetic foot. Working closely with frontline clinicians is another key element of our work. This does not only mean involving them into our research, but also supporting the clinicians themselves to answer their own research questions. Two very different but equally exciting new projects that were recently started through our collaboration with frontline clinicians are the use of tissue biomechanics to prognose the progression of adolescent idiopathic scoliosis and a non-invasive ultrasound-based method to measure intracranial pressure in people with traumatic brain injury.
Thanks very much for your time today, and I hope we gave you a feel for our inter and multidisciplinary work. We look forward to collaborating with you on wider clinical projects and welcoming you back to our lab and our university.